Well, hi, it's Tams with TrueMD. It's good to see you today. We're so glad to have the opportunity to go live today and talk about some things. I'm here today with Dr. True, and many of you have had questions this week about the level, and we are so excited to tell you about our beautiful red level that we use for medical purposes here in our office, something innovative that Dr. True came up with on his own. So proud of him. Dr. True, could you please tell us about this level and how you use it and why you use it?
I would be happy to explain how we use this. Normally speaking, right before we do a breast lift, even sometimes before we breast dog, we use the level. And it's very important to know that the nipples are level on a woman after we're done. Now, the problem is that some women have one shoulder lower than the other one. Like in this lady here, her right shoulder is a little lower than the left. The picture doesn't do it justice, but there is a little bit of difference. But what you want to do is you want to end up with the nipples being nice and level with that little bubble right in the middle. And it's very important because normally speaking, what most people do, including plastic surgeons, they measure from the middle of the sternal notch to where they're going to put the implants. Where they're going to put the nipple. Now that's okay as long as the shoulders are straight and level. The problem is women wear purses, it hangs down, they got a baby here,
yes.
You know, so one shoulder tends to go down. I'm sure you ladies can relate to that. One shoulder tends to go down, and if you look at yourself in the mirror and you really scrutinize it, most women have one side lower than the other. So I use the level to make sure that when the woman is standing, the nipples are level with each other. They're nice and straight, nice and level, because the measurements don't always do it. You can have one measurement here and here, the distances can be the same, but if the shoulder's lower, the nipple ends up being lower. And I've had a lot of patients come to me who have had breast augmentation and lifts before by another physician, and their nipples are off. And the problem is I look at them and their shoulders are off. So what we need to do is do the level. By the way, the patients notice that. I had this one lady come in today. She said, wow, I have irregular nipples. I said, yeah, you sure do. And I did the level on her. We saw it, and she did have one slightly lower. But then I looked at her shoulder was lower. And she said, when I did the procedure, I noticed it right off the bat. So people notice these types of things. It's very important. I like to do the breast dogs, breast lifts, so that they look really pretty and as symmetrical as possible. So that's my technique. But if you have any other questions about doing the technique of breast augmentation or breast lift, I would be more than happy to answer any of those questions, because I think I do a really good job. So if you're interested, call us.
Yes, and what you might want to do is check out our website. We've got some before and after photos if you'd like to look at them and see actually some examples of Dr. True's work. He's an excellent cosmetic surgeon, and we're really proud of the work he does. He takes such extra steps to make sure that things are perfect. He's very much a perfectionist. I've worked for him 22 years, and believe me, I couldn't keep working here if we didn't have great outcome. I'm just not the type of person that likes to deal with those type of things. We're so proud of him. So Dr. True, thank you so much for explaining that to us, and check out our website at truemd.com if you want to make an appointment for consultation. If you need to know more about Dr. True's certifications or his qualifications, it's on the web. All you got to do is click on the links. I'm Tams with TrueMD. Fill out a consultation sheet. Come see us. Like us on Facebook. Follow us on Facebook. We love our patients. Thanks so much for tuning in today. And thank you, Dr. True, for that very informative talk.
Thanks for the opportunity.
See you later.
Take care. Bye-bye.